Well, we'd like to welcome you to University Hospital's Conneaut Medical Center for another in our series of programs on medical topics that we feel will benefit our community. And we're very pleased to have Dr. Ajay Kumar with us today. Dr. Kumar is with University Hospitals. He's located just across the street from the hospital with his partner, Dr. Abby. And Dr. Kumar, what are you going to talk to us about today?
So today I want to talk about diabetes, high blood sugar mainly, and what you can do at your home to check it, and how can you prevent the complication because of high blood sugar.
Very good. Diabetes, unfortunately, is a very common problem, and if your blood sugar gets out of control, a lot of times you can't tell until it gets way out of control. But if the blood sugar is too high, the complications from that can be horrendous.
Exactly.
And so there is a real good reason to kind of understand how it works and how you can kind of keep track of things at home so you don't get in trouble. What is hemoglobin A1c? What is that?
So hemoglobin A1c is just a blood test
A blood test?
which we do. It's just a normal blood test. They take your blood sample, but it's very important test because it gives your doctor how much was your blood sugar in past 3 months. Okay, the average blood sugar. Okay, normally A1c value we want to keep below 6.5. If it's less than 5.5, it's normal.
Less than 5.5 is normal. And see, the deal is you may have a high blood sugar and then you get it under control and then it may escape your attention, this and that. The A1c gives the doctor a picture of basically how well your blood sugar has been controlled over a 3-month period. So if it comes back and it's high, that tells you that there are places that you can look to get it under better control.
Yes.
So it's just a simple blood test. If you're a diabetic, your doctor will make it real clear to you how often you should have that test, and they'll keep track of it with you, and then they can use that to help really tighten things up so that your blood sugar stays in good control.
Exactly.
Okay? So somebody's a diabetic and they're just living their life at home. They've seen their doctor. They're on their medications. What kinds of things should they be doing at home to help protect themselves?
Yes. There are a few things that a patient with high blood sugar need to take care. And the first thing is to take care of the eyes, because the patient who have high blood sugar, their eyes, their vision power decrease over the time period. And there are few things which you can be aware about that, and you can decrease the risk of this complication.
Okay, and again, just so people have an understanding, the problem with high blood sugar is that it injures the blood vessels themselves. And the blood vessels go everywhere in the body, including to the eyes. And so diabetics who have eye problems, they're having problems with the little blood vessels in their eyes. And that's because of the high blood sugar. So what you need to kind of link in your mind is that high blood sugar means injury to the arteries. When the sugar is high, the arteries are being injured. And that's why we want to keep the sugar under good control. And if the blood vessels to the eyes get damaged, then of course your vision suffers because of it. So in terms of the eyes, what should people be doing?
The first thing, whenever they get any problem with the vision, I will show you a simple picture. I have it with me. If you can focus on this picture. It's not it's a normal vision. If you can see two child with a football, okay? There is another picture. When you have some problem with your high blood sugar, you see picture like this, like floaters in front of the eyes. That's the time you need to see an eye doctor.
So what they might see is that there's parts of the picture that they can't see.
Yeah. There's some, so if you see a picture, there is a part of the picture in between you cannot see, and there is only black floater in between. That's the thing that your blood vessels in the eye are getting affected.
So if the blood vessels to the eye get affected, what that means is that part of the eye that is responsible for vision drops out. So you don't have the whole retina to be able to see the whole picture. Part of it gets damaged, so you have a black spot there. So if you see that, that's a big red flag.
That's a big red flag, yes.
Okay, so you should see an eye doctor right away.
Exactly.
Should diabetics have regular exams with the eye doctor?
Yes. So the first thing, whenever you see this thing, that's a red flag. Second thing, how you can prevent this thing to go up to this level. So the patient who have high blood sugar, they need to go to an eye doctor every year.
Every
Okay.
year?
Every year.
Every year. And is that to an ophthalmologist or an optometrist or?
That's an full, so what they do a simple exam on your eye. They dilate your retina and they look inside your eye. So they can look the picture how's your retina looks like. If there are some blood vessels which are not looking good, they can fix it.
Now, so they should be seeing, once a year, they should be seeing
Eye doctor,
an ophthalmologist,
ophthalmologist,
not an optometrist.
not an optometrist. Yeah.
Yeah, because they do different things.
Exactly.
And when you start talking about the blood vessels in the eye, you're talking about an ophthalmologist.
Exactly.
And so diabetics should be seeing an ophthalmologist regularly, once a year, and then sooner if they start developing problems.
Right. Right.
But if they can keep their hemoglobin A1c at 6.5 or less, they're unlikely to get trouble with their eyes.
Exactly. That's true.
Okay, so you're starting to see how important this hemoglobin A1c is as an indicator of keeping the blood sugar under good control to protect you against these terrible
Yes.
things.
Mm-hmm.
All right? Okay, so now that people know about taking care of their eyes,
Exactly.
so what other things should they be looking at?
There is another problem with the high blood sugar is in the foot. So what happens? The nerve supply to the foot, they get irritated. So the people cannot feel what's going on in the foot. Okay, let's say if they don't have sensation on the foot, if they place the foot in nail or something, nail board or something, they cannot feel it. If you cannot feel it, you will not going to take a look at it. It will going to get bigger, and ultimately it reach the bone, and then when you can have bone infection.
Well, yes, Dr. Millman was on
Exactly.
a little while ago and talked about this, and I think it really bears repeating. It's a situation in which the warning signals that your body normally gives you don't work. That's obviously a dangerous situation when you can't get a warning. And again, it's the blood sugar damaging the blood vessels that supply the nerves, because even nerves have little blood vessels, and they get damaged by diabetes too. And if they do, then the nerve doesn't work.
Yeah.
So then, as doctor says, you step on a nail and can't feel it, don't even realize it's happened. Now you've given yourself an infection. And if that infection progresses and the infection goes into the bone, we've got serious problems. We've got serious problems. Those kinds of infections are very tough to clear. You got to be on antibiotics for a long time, and that still might not even clear it. And this is why when diabetics think about their feet, they worry about losing toes or losing
Yeah.
part of the foot. This is how it happens.
Mhm.
So what should people do at home to protect their feet?
They just have to check their foot every night before they go to bed. At the end of the video, I will going to show you how you have to check your foot. Okay, it's just simple. It's just a simple check only for 2 minutes, and you can save your foot.
It's worth it.
It's worth it.
It's worth it if you can save your foot.
Yeah.
You know, and some of the other things that were talked about is making sure your shoes fit
Yeah.
so they don't rub and create sore areas.
Yeah.
Okay? And it's probably not a good idea for diabetics to ever go barefoot.
Yeah. That's a terrible idea.
Yeah, you can understand it, you know, I mean, if you go barefoot, you never know what you're gonna step on, and if you can't feel it very well, you might not even know that it's happened. So diabetics have to get the idea in their mind that their foot is fragile.
Yeah.
You know, it's like when you mail a package, if you mail something that's made out of steel, it can get banged around and that's okay, but if it's very thin glass, you really have to protect it or it'll break. That's how diabetics' feet are. They're very fragile.
Yeah.
And so they need that extra protection. Doctor's going to demonstrate how you examine your foot, but just remember that it is fragile. So you're always going to make sure that things fit and that you don't injure it. And you know, when it's time for your nails to be cut, you have to be careful with that. One of the things that Dr. Milliman mentioned was that podiatrists like her, for example, diabetic nail care is routine. It's a covered benefit.
Mm-hmm.
So they can examine your feet and trim your nails and do all that sort of thing safely so you don't wind up causing an infection to yourself.
Wow.
But the take-home message here is how fragile your feet are and how you have to always think of them that way so that you can protect them.
Yes.
All right. So we've talked about the eyes, we've talked about the feet.
Mm-hmm.
What other things should people at home be aware of?
Remember, when you have high blood sugar, you can get the problem with your heart, your kidneys, okay? And there are few things you really have to certain, like you have to check your blood pressure, okay? The blood pressure should be under control. When you have high blood sugar and you have blood pressure, it's a terrible combination. We have to control both of them, okay? It will increase the risk of your having stroke, having a heart failure, or having some heart problem, okay? And it can also endanger your kidney, and it increase the risk of progressive kidney failure.
Diabetes is one of the top 2 reasons that people go on dialysis
Exactly.
every year. And boy, I'll tell you, talk about something that's not very nice. When your kidneys are getting in trouble, you can't feel anything. You can't tell. I mean, you can be losing kidney function, really losing kidney function, and not know it. Losing kidney function doesn't mean that you can't pee. That's not, well, there are certain forms of kidney failure where you can't pee, but that's not what we're talking about. You'll be able to pee okay. So I'm peeing fine. But the problem is the kidney is a very complicated little metabolic machine. It constantly is looking at your blood and saying, you got too much of this, we're going to take it out, and you don't have enough of this, and so we're going to help conserve that. So it's metabolically, it's very active. It's constantly intervening in the blood system to purify the blood and keep it in balance and so on. That's what gets lost. That's what gets lost. And so you can't clear toxins and the electrolytes in the body, sodium, potassium. Don't want to get too complicated here, but those things have to be regulated properly or things just don't work. And that's what gets lost. but you can't feel it,
Yeah.
and you can't tell.
Mhm.
Now, if somebody keeps their hemoglobin A1c at 6.5 or less, they can assume they're protecting their kidneys.
Yes.
There it is again. Same thing about the heart. And I think, we pick up on what doctor said. High blood pressure, big problem. High blood sugar, big problem. Put them together, 1
Right.
plus 1 equals 4.
Yeah.
It doesn't equal 2. It equals 4.
Yeah.
In this kind of a case.
Exactly.
So we're talking about prevention here.
Mm-hmm.
We're talking about prevention. And doctor, I'm sure, will tell you that how much an ounce of prevention is worth here. Because once things go on for too long, the damage becomes irreversible.
Yes.
Then you can't get it back. There's an acute phase where you can, if things kind of get out of control, you can bring it back. But if the A1c is up around 8 or 10 or 12, and you don't know it, and it goes on like that and on like that, then damage is happening silently
Yeah.
that becomes irreversible, and you can't get it back.
Yeah.
So that's why we emphasize prevention and monitoring in diabetes.
Yes.
Do you want to get into at all the kinds of medications that are involved in?
Yeah.
Like, for example, when does somebody need insulin, and can somebody be managed without having to have insulin injections?
Okay. Let me talk about the how to take care of blood sugar. There are two kind of treatment. One is lifestyle modification, and second is giving you medication. Medication can be with the pills or with the shots. Okay. Let me talk about some lifestyle modification first.
Very good, very good.
So these lifestyle modification like regular exercise, if I'm saying regular exercise, it should be at least more than 30 minutes, or you should be able to have sweating, and it should be more than 5 days a week. It's very important, okay, that you exercise regularly, because it will decrease your weight. It will increase the insulin sensitivity. Insulin is just an enzyme which regulates the blood sugar in your body.
So if people are exercising regularly, their insulin works better.
Exactly, yeah.
That's good.
Yeah. Second, I always tell my patient, and it's very important, cut down on your smoking. Smoking will increase the inflammation in the blood vessels, and on top of that you have high blood sugar, which also increase the risk in the blood supply. If you are diabetic, if you have high blood pressure and you are smoking, it means you are certainly going to have heart problem earlier than what it used to occur only with the with the blood pressure and with the blood sugar only. You need to cut down on your smoking. It's extremely important. It decreases the risk of heart problem, stroke, many kind of cancer as well, colon cancer, lung cancer, and all these things.
And again, here's where diabetics, this is why it's such a tough condition to have, and why you have to have the mindset for it. Smoking it causes problems for people who aren't diabetics, and for people who don't have high blood pressure. Smoking still causes problems.
Yeah.
But in the setting of a diabetic, particularly a diabetic with high blood pressure, as so many diabetics have,
Yeah.
smoking is way, way worse. It does more damage than it would to somebody who doesn't have those conditions. So you have to, if you're and believe me, I understand how tough it is to quit smoking. And it's real easy for doctors to say, well, you should quit smoking, and the patient is thinking, yeah, well, you try it.
Yeah.
Well, I did. I quit smoking in 1975. And they might say, well, you're not a real smoker. You better believe I was. Camel non-filters, all right? And I quit, so I know how hard it is, and it was hard. It was not easy for me. It was hard. But it's also not impossible. You can do it. And if you're a diabetic, and particularly if you have high blood pressure, you have to look at smoking as a form of suicide.
Yeah.
I mean, let's quit dancing around here. If you have high blood sugar and high blood pressure, smoking is basically a form of suicide. It's going to cause a heart attack, a stroke, way earlier than it would otherwise. I mean, it's just miserable.
Yeah.
So you have to get very, very serious about smoking if you're a diabetic.
Yeah. Just one point about the smoking. If I say stop smoking, it's very hard. Okay. When the patient come to me, I just ask them to cut down the smoking. Okay. If they take 10 cigarettes, I promise them to do it only 8 cigarettes or 5 cigarettes. When they come to me next time, oh, it's working. And believe me, it's working for many patients. When they come for 5 cigarettes, I ask them, okay, cut it down to 4 cigarettes now. If I tell you stop smoking, you will never going to do it. Cut down the smoking. 10 to 8 to 5 to 4. And believe me, even if you stop smoking 1 cigarette less, it will make a huge difference.
That's a very important point. That's a very important point. Of course, if you can get off cigarettes completely, I mean, just think about how expensive they are. You just take that money and throw it in a jar and watch that jar fill up, okay? But even cutting down is helpful. That's a very important point.
Yeah.
Okay, so lifestyle, smoking, and exercise.
Exercise, watch your diet. In the hospital and in the clinic, we have dietitian. They can counsel you what to eat, what not to eat. Okay, we can talk about it at the next time, what to eat, what not to eat. But we have dietitian both in the clinic and in the hospital. They can counsel you. Okay. The second thing I wanna talk about the medical treatment. Okay. If your A1c is around 7.5 and if you do these kind of thing, you may not need the medication at all. Your blood sugar may be very well controlled only with these things. And there was one patient of me, he had A1c of 15.2, not me, but my partner, Dr. Abby. She did only lifestyle modification. A1c from the 15 came down to 7.
Wow.
Without any medication.
Without any medication. That's fantastic.
Yes. Okay, so other is the medication. Okay. There are 2 type of medication. One is taking the oral pills and one is taking shots. Okay. If you, let's say your A1c is 8.5, so your doctor can try giving you oral medication first. Okay, he can watch your blood for the kidney function and everything. That's a separate issue. If you do lifestyle and if you take your medication, your A1c can be controlled only with the oral pill, and you never have to go for the shots. Many people don't like shots. I also don't give shots unless patient needs it. But let's say we gave you oral pills, you are doing the lifestyle changes and still your blood sugar is not very well controlled. We have 4 or 5 different type of pills. We can give you one pill, then if it's not controlled, we can add another pill, we can add another pill. Even after adding 3 pills, your blood sugar is not controlled, then we can jump onto the insulin. There are different kind of insulin. I'm not going to talk about the insulin.
Right.
But yeah, your doctor can give you shots and that can take care of your blood sugar.
I think that it's very important for people to hear this. getting the A1C down to a level where it's not damaging your blood vessels. I think from the discussion today, you can understand why this A1C is so important, why not damaging your blood vessels is so important because of your eyes, your heart, your kidneys, your feet, okay, peripheral vascular, these things that we've been talking about, strokes. If you are keeping the A1C where it should be, then you minimize the damage to the blood vessels and these terrible things don't happen. So getting the blood sugar under control is extremely important. And he's talked about lifestyle, and he's talked about pills, and he's talked about insulin. And people will find, if they take this seriously and work with their doctor, they'll find out where they are on that spectrum to get their blood sugar under good control. If you require the insulin, and some people do, because diabetes is not just one thing. There's people have varying degrees of difficulty with their blood sugar. Some it's fairly easy to control, some people it's very tough to control. But the point is, you can control it, if need be, with insulin, and obviously, it's worth it. The important thing is protecting those blood vessels, and if it takes insulin to do it, it's worth it.
Yes. One important thing I want to focus here, when should I go to a doctor?
That's very important.
So, there are few things. If you get up in the night to pee 3 or 4 times, or you pee in the day like 7 to 8 times, this may be very well indication to check for the blood sugar. Okay. Second thing, if your blood pressure continues to be high, more than 140/90, it's a value. Okay. If it's more than 140/90, by checking 2 times at least 4 weeks apart, that's an indication to check for the blood sugar. If you cross the age of 40, once you pass the age of 40, that's another indication to check for your blood sugar. If you have high cholesterol problem, that's another indication to check for your blood sugar. If you have heart problem, kidney problem, you will check for diabetes.
And your doctor will know all this.
Your doctor, if you follow a doctor, he should be knowing about this, and they know about it.
They know about it. So there's lots of different things that the doctor will pick up on
Yeah.
that can influence this, and that it's important to know about. And so if you're working with your doctor the way that they tell you, these things won't be missed.
Exactly.
That's the important thing. Okay, very good. So if people find that all of a sudden they're peeing a lot more, that may mean that their blood sugar's getting out of control. That's something you need to see the doctor about. All right. Very good. Well, do you want to demonstrate that exam then?
Yeah. All right, sounds good.
Dr. Kumar is going to demonstrate how to check your feet on a daily basis to make sure that you're not getting into trouble.
Okay. It's just a simple, I will say 1 or 2 minute test. Every night before you go to bed, you have to do this thing. Keep your feet like this. Check your feet. It looks fine. Then, important thing, you always have to check between toes. You have to look for any wound, any ulcer, any fungal infection. Just look between toes, look at the bottom, everything is fine, you're good. It hardly took 10 seconds. 1 feet, and you have to do same thing with the other feet. 30 seconds, you are done.
So any open area,
Any open, yes, any open area.
then what should they do if they find it?
If they find any open area, they should call their doctor, okay? They keep the area clean, okay? Avoid tight-fitting shoes, okay? And now we have Dr. Millman, CJ, as Dr. Bryant told you, it's covered or something. So they can take care of this thing. It's very easy to manage in the initial part, okay? We don't want this to go up to the bone. That's the whole job.
So if a diabetic finds an open area on their foot, they probably should give Dr. Milliman a call.
Yeah. That,
You know, I mean, well, this doesn't look like anything, it's just a little open area. Well, there's a saying that mighty oaks from tiny acorns grow. And if you're a diabetic, a small open area like that can turn into a big problem fairly quickly.
yep.
So it's important to nip it in the bud, and the podiatrist can certainly help you do that.
That's it.
All right. Well, Doctor, we obviously appreciate you coming down and helping us. And folks, we hope that the information that's been presented here today was clear and that you could understand what we were saying. If you have any questions, you can call my office, and if they're for Dr. Kumar, we'll make sure that he gets those and he will answer them on future shows. Our pal Pat Williams couldn't be here today. He had another commitment, but he'll be here next time. And in a couple of weeks, we'll be back. We're going to have a physician, a UH physician from Geauga, who does rehabilitation medicine. And I can tell you that what she does and what she has to say is going to be relevant to a lot of people in our community. So we hope to see you then. Meanwhile, thanks for joining us today here at University Hospital's Conneaut Medical Center.
Thank you.